Good morning. I'm Mark Philpart with the Alliance for Boys and Men of Color and Policy Link. Thank you for joining our second of 8 Cannabis, Equity, and Racial Justice virtual convenings. In today's session, you'll hear about the Prop 64 grants being issued to nonprofits, local health departments, and tribal organizations across the state to support services to youth and families and communities most impacted by the war on drugs. In a moment, the Youth Forward team will provide an overview and introduce the speakers to today's session. Before then, I want to take a moment to remind us of the importance of doing this work with an equity and racial justice lens. From the first session to the last, each virtual convening underscores the importance of equity and racial justice by acknowledging the harmful impacts of the war on drugs on low-income people and communities of color. Economic deprivation and concentrated poverty, blight, gentrification, the destruction of families, over-policing, domestic and intercommunal violence, and mass incarceration are just some of those harms. Yesterday, most of us probably commemorated Martin Luther King Jr.'s birthday. Yet, we must not forget that across every city in America, you'll find the same conditions he died fighting against, still present to this very day. We must continue to uplift the lasting impact and the generational trauma and violence because they perpetuate harm, and that harm will not end unless we take direct action to break the vicious cycles produced by those before us. The more than $80 million being distributed through Prop 64 grants comes with the responsibility to do the bold and innovative work necessary to acknowledge, reconcile, and heal from the racist and unjust policy decisions enshrined by the war on drugs. The only way this happens is if the funds are directed to real community-based efforts, prevention, intervention, treatment, education, and other programs and structural changes that have been shown to promote healthier and stronger communities. Through Prop 64, California is continuing to lead the way and move beyond investments rooted in punishment to investments rooted in care. In today's session, you'll hear from leaders within our state government who are managing grant programs that will allow many of you to join this movement to end the war on drugs and repair the harm. You'll now hear a message from Governor Newsom about his prioritization of investments and support for this work. From the beginning, Governor Gavin Newsom has been a prime proponent for Prop 64 when it was a state initiative and now in its implementation. The governor has also made it clear that legalizing and taxing cannabis is not about just generating revenue for revenue's sake, but that these revenues should be invested to support all Californians, especially those in communities most impacted by the harmful war on drugs. We're thankful for the governor's hard work so far and look forward to partnering on the necessary work ahead. And now, a word from Governor Gavin Newsom.
Everybody, it's Governor Gavin Newsom, and I'm honored to just lend my voice and gratitude and appreciation to each and every one of you that are working so hard to end this war on drugs, which has been nothing more than a war on poor people and people of color. I was very proud to be involved in the drafting and the deliberative process building to get Prop 64 on the ballot. And while imperfect, the reality is this state is doing something at scale no other state in our nation has ever attempted to do. And our success fundamentally will have impact all across not only this nation, but around the world. You know, just since the beginning of our administration, we've given out over $80 million of grants to community organizations, local governments, tribal communities in order to bring the healing and the health services, the legal support, and the job training to youth and adults that they deserved and were promoted and promised in that initiative. And so I just want to thank all of you for holding us to account, for expecting and demanding more. And it's in that spirit of gratitude and that spirit of recognition that I now want to turn this over to one of our key staff members and our regulatory team to talk more about things we can do to partner with you, to support our youth, to support our families, to support our local communities, and share this critical information on Prop 64 grant programs.
Yes, hi everyone. This is Jim Keddy with Youth Forward. You'll be hearing from the state agency staff in a minute, but I first wanted to thank Governor Newsom for his welcome and his remarks, and for his strong commitment to investing state cannabis revenues in communities of color impacted by the war on drugs. For the next hour, you will hear from the 4 state agencies that are providing grant funds to local communities. We and many other community organizations around the state have been providing input to these agencies over the last few years with the goal of ensuring that these precious dollars make a real impact in Black and Brown communities. I personally want to thank the leadership of these agencies for their openness to receiving feedback and their willingness to hear from groups on the ground. Each agency will do a slide presentation, and at the end of the presentation, they will provide contact information. You will receive a link to the recording of this session and the slides within the next couple days. Following the presentations, we will do some questions and answers, assuming that we have time. So please add questions to the comments section as we go along. So without further ado, I'd like to introduce Alejandro Regosa from the Governor's Office of Business and Economic Development.
Good morning, everybody. My name is Alejandro Regosa, as Jim just said. I work for the Governor's Office of Business and Economic Development. Hope that everybody had a fantastic holiday weekend. We're very excited to share about our program. I first would like to thank all the members of the Community Reinvestment Grants Program for their deep care and commitment to further our mission. As mentioned, we have been working to develop and implement this program, and we're just so very excited to share about our program this morning. For today's presentation, we will go over the history and background of CalCRG, talk about funding details, what has been our progress to date, eligibility criteria, and the funding categories that CalCRG seeks to fund. The Governor's Office of Business and Economic Development serves as the state of California's leader for job growth and economic development efforts. Among the many services that we provide are permits, business assistance, retention expansion of services, site selection, among many others. The Community Reinvestment Grants Program, or CalCRG, was included in Proposition 64 in 2016, and in accordance to the proposition, GOBIS shall award grants to local health departments and community-based nonprofits to further the work in communities that have been disproportionately affected by past federal and state drug policies. Now, we have interpreted that to mean the war on drugs, which has been the criminalization and the use of sale of use and sale of certain substances like marijuana and crack cocaine, with a particular focus on targeting African American and Latinx communities, thus making the CalCRG program an equity program. The funding categories displayed on the screen right now are the 6 service categories that CalCRG seeks to fund, and we will cover those later in the presentation. Statute also tells us how much funding we have each year, starting in fiscal year 2018-2019 with $10 million. The allocation increases by $10 million each year until it caps at $50 million in fiscal year 2022-2023. Of the total awards that GOBIS gives out, at least 50% of them must be given to community-based nonprofits. Lastly, there is a 4% administrative cap on costs related to the implementation, administration, and oversight of the Community Reinvestment Grants Program. Now, it is important to note that this 4% cap, it's for GOBIS and does not refer to the indirect rate for grantees. Our mission and guiding principles have been the results of months of thoughtful conversations and stakeholder engagement and discussion. So we're very excited to share that the CalCRG mission is to advance health, wellness, and economic justice for populations and communities harmed by the war on drugs. At CalCRG, we are responsive to and focused on populations and communities disproportionately impacted by the war on drugs. We're grounded in science and data, while being receptive to emerging and innovative approaches. We advance whole person care and trauma-informed care. Lastly, we are accountable to taxpayers and stakeholders. So far, CalCRG has given out 68 awards. 40 of those awards were for single applicants, which received approximately $11 million. The remaining 28 were collaborative applications that received approximately $17 million. 47 sub-grantees support the work of these 28 collaborative applications, and according to reports from our grantees, approximately 12,000 individuals have been served, and 713 of them have been placed in jobs. CalCRG is already making a difference. Some of our grantees have been recognized for their innovative services. Impact Justice is one of them that we would like to highlight today. They have been featured in several news outlets for the innovative approach to housing shortages for individuals reentering society after incarceration. And their business model is like an Airbnb style model in which individuals are placed into a host home that provides them not only with housing, but with emotional support as well, and help in the community. Now let's hear directly from some of the hosts and the participants of the program in this short video.
For the ones that are coming out, I hope that they understand that they have been forgiven. They have another opportunity, and having another opportunity, that's a great start.
Man, I believe in helping. And I want to be right here to help them through that problem or whatever they're going through. I want to be right here for them. To let them know, oh, you don't have to worry about that. We can handle that. That's nothing. You know what I mean? We're not just giving people a room. We're creating relationships. Relationships between the homeowner and the people in the home and the participants. And time again, it is what we hear from everybody involved in these relationships, that it is that relationship which is so powerful.
Since my release, I've been working at a homeless shelter, and that further opened my eyes to the need for housing. Failure was not an option for me. It wasn't. My body may have been incarcerated, but my mind never was.
For this funding round, we have $28.8 million available for funding, and the grant term will start May of 2021 and will go through April of 2024. We received 418 applications. We're excited about it, and it was approximately $200 million in funding requested. We're currently in the evaluation phase, and we expect to be making awards in the spring, and we have our next funding will be opening in the summer if you're interested. As stated earlier, local health departments and community-based nonprofits are eligible to apply to CalCRG. It is important to note that for the local health departments, they must be one of the 61 local health departments in California with an appointed public health officer. Further, for community-based nonprofits or CBOs, CalCRG seeks to fund CBOs that have deep ties in the communities and are led by members of the community, and make an intentional effort to engage the prairie population in service delivery, evaluation, and other important aspects to provide culturally appropriate services. There are other eligibility requirements as well that we will not be covering in this presentation, so we please encourage you to look at our grant solicitation if you're interested in applying to see a full list of requirements. The impacts of the war on drugs can be felt across all communities in California. However, statute indicates that we must serve those that have been disproportionately impacted. As a team, we had to decide how to interpret disproportionately impacted, and we decided to do it in two ways, at the county level and at the census tract level. At the county level, we use drug arrest data from the Department of Justice, and at the census tract level, we use different indicators: poverty, unemployment, one-parent households, and high school dropout rates. Further, knowing that each community is unique in its context, its history, and the way that have been impacted by the war on drugs, we wanted to give an opportunity to our applicants to share this with us. So we have included several questions in our application so applicants can share with us how their community has been specifically impacted by the war on drugs. Here's a full list of the eligible counties, which include Los Angeles, Alameda, Sacramento, Yolo. If you want to refer to the full list at any point, you may do so. It's included in the grant solicitation. As stated earlier, there are 6 funding categories for CalCRG, starting with job placement, which the ultimate goal is to place clients or individuals in a long-term job. There may be other services that support this goal, but ultimately it is the placement of an individual in the job that should be the ultimate goal. For mental health treatment, the services should be geared to helping clients achieve mental well-being through either clinical or non-traditional means. Similarly, for substance use disorder, is to help them recover from substance use disorder through either clinical or non-traditional means. We know that individuals reentering society face many barriers. That is why legal services to address barriers to reentry is one of the services in CalCRG, and this is geared towards helping clients reenter society and remove some of these barriers that are hindering their economic and overall well-being. For linkages to medical care, these are services that are geared toward helping an individual secure medical linkages. However, CalCRG is not funding the medical care itself. And lastly, for assisted navigations, these are services that are geared towards helping individuals access the many services that are available to them in the community, which often assisted navigation includes doing an assessment on the individual and their needs and then linking them to the different services that may be available to them. To close, we would like to echo the words of Governor Newsom. We have a moral responsibility to address the war on drugs, multi-generational impacts that have marginalized communities throughout our state. Programs like CalCRG exemplify California's commitment to this responsibility, and it ensures our cannabis marketplace remains rooted in social justice. If you have any questions, feel free to contact us. Here's our phone number, email, and also our web address. We're very excited to share that we have 3 analyst positions that are opening, and we're looking for individuals with lived experience who are passionate about economic justice. So feel free to reach out for that as well. Thank you for listening to our conversation. Are there any questions?
Alejandro, we're going to do questions towards the end, but thank you so much for that presentation on the Community Reinvestment Grant Program. My name is Sarah Michael Gaston with Youth Forward, and I focus on state cannabis policy and ensuring that these tax revenues go back to our communities that have been disproportionately impacted by the war on drugs. And it has, been a long process, but all of these 4 grant programs and the administrators have been working with us to ensure that small nonprofits and tribal communities really can obtain, this money. And it's not perfect, but we are continuing to work on it and collaborate with the communities on the ground to get these monies in their hands. So next up, we have Marlise Perez from the California Department of Healthcare Services.
Hi, thank you so much, Sarah, and really, really excited to be here this morning and talk to you about the impact that we have had and seen at the Department of Healthcare Services, thanks to this revenue that has been dedicated to prevention activities for youth. And so you'll see when Prop 64 was passed into law, in the law was created the Youth Education, Prevention, Early Intervention, and Treatment Account, which we commonly refer to as YAPITA. So if you hear me say that, that's what I'm talking about. But basically how this account was established in law is when the law was written, there was money dedicated from the tax revenue to these activities to help youth prevent having a substance use disorder. And so you'll see here, there are 4 areas where this funding has been dedicated. The first is with the California Department of Education, and that is for childcare in high need communities. And then of course, here with us at the Department of Healthcare Services, which I'll be speaking in my presentation about how we're utilizing the funds. Also with our sister department, the California Department of Public Health, and they're using that funding for public education and data surveillance. And then also our California Natural Resources Agency, which they'll be speaking to you today as well. So you'll see here, we have received funding starting in our fiscal year 1920, and then also fiscal year 2021. And then there is funding in the governor's January budget for fiscal year 21-22. And so I want to talk today mostly about the Department of Healthcare Services and what our role is. So at the Department of Healthcare Service, we actually oversee youth prevention, not only for this grant program, but also for federal funds and other funding that we receive. So we're really grounded in youth and really want to ensure that they are once again protected and empowered so that they don't go down the path of having the disease of a substance use disorder. And so what we've really done in our vision around this funding is really looking at youth social justice and really ensuring that this is a community groundswelling, that it's rooted in the communities where these youth live. And you'll see throughout what we have done in not only how we've built this program, but how the program has been, really implemented is a focus on the youth. And so what we're doing, not only youth, but really having that focus once again on low-income youth in urban and rural areas. And these are youth that are disproportionately impacted by the war on drugs in communities of color. So we've done a lot of work to ensure that this funding goes to that effort. We've been really also wanting to build the capacity of current organizations that are working on youth mentorship, really looking at organizations that have peer support activities as well, and to really bolster them up and to help them and to fund them in ways that perhaps they haven't been able to be funded before. And once again, we also have a focus on impacting the policy and systems and environmental change, once again, but not only from an adult lens, more importantly from the youth lens and having that youth voice. So we have lots of stakeholder engagement that I'll talk to you about. And then also what we did when we put this work together is we work with our partners at the Sierra Healthcare Foundation. They are amazing partners. They've been helping us release this funding. They have ties in the communities where we're working. It's just been a phenomenal partnership. So I just really want to acknowledge them, that they've really been partners with us in this effort. So when we started this work, we convened what we call a Prop 64 advisory group. I know it's a very unique name, but what our advisory group does is we really had members apply from many different areas. And we have members not only that are currently in working with youth, maybe youth organizations, have a passion for youth. We have Sarah, who introduced me as one of our advisory group members as well, who is a youth herself that has an immense amount of knowledge and information to share with us. So what our advisory group does is they help us on making our decisions. They've helped us develop both our round 1 and round 2 grant opportunities. They help us with the data collection, anything that we need assistance with, our advisory group has met with us. We've met about 6 times. They're a phenomenal group and it's been really, really beneficial. We also have our stakeholders, like I mentioned before, is the youth themselves. We kicked off a listening session, and the first one was run by our partners at Youth Forward, and really just wanting to get some guidance around, even before we started off, what would be most impactful for the youth. We've also had other listening sessions done by the Sierra Healthcare Foundation, and our grant awardees, they also have to have listening sessions of the youth that are being impacted in their programs. And so we didn't just want a one and done with youth. Youth are the whole purpose of this funding, and we didn't want to lose alignment with that. And so you'll see there, all kinds of ways that they've helped us frame the messaging of the project, really helping us guide the grant funding. And like I stated, for the sub-grantees, really helping that program be guided as well. Next slide. Awesome. So some of our project strategies is we defined what are youth. So those are individuals aged 12 to 26. We decided what we didn't want is just to put grant funding out for a year and have the program start and stop. So we created a 3-year cycle. So all of our grants run on a 3-year cycle. And so once they're awarded, they know they have 3 years of funding to really make an impact and reach those program objectives. Once again, we're investing in the community and community-based organizations, nonprofits that are reflective of the community served. We are also reaching those communities that I mentioned of color who have been disproportionately impacted by the war on drugs. We really look in and we do quite a detailed analysis as to where these programs are and where they're serving the individuals. We also invest in social justice youth development. And like I mentioned, peer support and mentoring. And so for our first 2 rounds, the applicants could request up to $1 million in order to meet the program objectives. Next slide. So what have we been doing with this money? I just wanted to highlight today some of our project successes. And so our first outcome is we have awarded over $50 million already in 58 community-based and tribal organizations across California. And I do just want to mention our tribal partners for a moment. We have over 108 federally recognized tribes here in California. And so when we were developing this grant project, we really wanted to ensure that we reached to our tribal members as well. They've been faced really, really hard with the opioid epidemic and also now with stimulants. And so we wanted to ensure that our tribal communities could also really have some funding to put towards prevention. So we're really excited that we have some of our grantees are also with our tribal organizations. And so you'll see here in our first round, we had over $20 million invested in our 26 projects. And then in our second round, we have close to 30 million invested in 32 community partners. And if you want to see, we have our website here located here on this slide. It's www.elevateyouthcalifornia.org. And I'll be talking a little bit about our website, but you can see the full list and the map of where our awardees are located in California. Next slide. So second outcome is we have been implementing all of the programming that I've been talking about. You'll see here we've reached almost 4,000 participants in over 300 program activities. And this time period is this is some of our recent data from April of 2020 through September of 2020. So some of these projects obviously just kicked off last year. So we have, this is our first set of data. And like I mentioned, we've had over 18 listening sessions that the awardees themselves have done as well. So this is also information that you can see on our website. And these numbers will obviously be increasing as the grantees continue with their services. Next slide. So we've worked directly in communities of color. You'll see here, this is once again from that same data period, but it really shows some of the communities that we are impacting through the projects. We're really excited about that because this obviously was a huge, priority for us. And so we are reaching that. So very, very excited about that as well. Next slide. All right, so our fourth outcome is we have launched our Elevate Youth California online presence. So once again, here's the website that I was talking about earlier. We have also established branding guidelines and social media accounts. But on this website, it's not just for our projects, but it also has other tools and resources that we're really hopeful that other youth organizations and youths themselves can utilize in their work as well. Next slide. All right, so obviously we are all still under a public health emergency with COVID, and so that has had an impact on our projects. But like I said here, it's challenges and solutions. And so our projects, especially in round one, we're just starting to kick off and then COVID hit. And so what we've had to do, and they've done really well, is adapt. And so, they had all these youth engagement activities planned, a lot of them face-to-face, so they've had to adapt into the virtual world. But because of, some of them had technology issues, or some of the youth that they're serving had technology issues, that became an issue. And so what we've really done is help kind of direct the projects, help them, have more flexibility. Some of them have had to shift some of their funding and to assist the youth so they could actually be receiving the services. And so perhaps that was around technology, or the organization themselves didn't have a way to do technological reach out and engagement. So they've really adapted well, and they've been able to have those programs that I mentioned on the outcomes. So we're really, really proud of them that they've been able to make the shift. And we're also super excited that this funding is so flexible. A lot of other funding types don't allow any kind of assistance with technology. So we're really, really happy that we've been able to utilize this. And so the youth have been able to be reached and engaged in this effort. And what we also did is we really developed a technical assistance survey, because we wanted to know, how can we help the projects, through this time? What did they need? What kind of help from us and the Sierra Healthcare Foundation? What were their needs? What were also, what were the challenges occurring in their community as well? And so we put that out. And next slide, please. And so what we identified when we put the survey out here, you'll see it was in the summer of last year, which feels like 4 years ago, I'm sure, to most of us. But so what we helped is around, having effective skill building activity alternatives. There was a lot of sharing among the projects as well, of what they found to be helpful best practices for mentoring and bonding while social distancing, really how to reach the youth through this social distancing. Also, effective use of technology, as we all know. I think we've all learned a lot of tips of the trade, but how does that work for youth? And what are some tips and things and platforms that worked with them? And then also around organizational resilience and mental health and avoiding burnout. We are very concerned, especially at the Department of Healthcare Services, for our young people, the diseases of substance use disorder and mental health. Social isolation is not good for that. And so, really reaching out with ideas and resources around that as well. While our whole goal is to prevent a substance use disorder, we also recognize that some of the youth that we're touching, they may already have a substance use disorder. So really helping the programs understand, how do you reach them for those individuals that need that help, but how do you reach them also through technology? And so a lot of work around that. So tons and tons of support that we've been giving the projects. Like I mentioned, they really have shown this resilience, and I'm sure it's because of the young people that are at the organizations. They have just been empowered and quite honestly really have been inspiring us with incredible work that they've been doing. Next slide. All right, so if you are a youth organization listening today, or you have ties to one, you may be asking, is there going to be more funding? Well, there is. So in the governor's budget, he released what we call round 3. So there is funding that is going to be coming out in 2021. And so this is our project cycle. So even if you as an organization maybe aren't ready right now to apply, it actually comes in the fall is when we release our request for application, but maybe this year doesn't work for you, but this is actually how we have been releasing the funding. And so as long as this funding is available, this will be our project life cycle. And so we release the request for application, and this is after working with our advisory group through the spring and the summer to develop the priorities and the focus areas. And then we close that in September. And then we review everything in October. And then in November, we announce who our next awardees are going to be. And so, like I said, if you are interested in applying or learning more, you can go to the Elevate Youth California website, and that is where we also post all of our funding opportunities. Also really lists out, who would be qualified, so you can get a head start on that if you're interested as well. Next slide. Awesome, great. Well, this is our contact information at DHCS. I do just want to acknowledge my incredible team that works at the Department of Healthcare Services, led by Denise Galvez, and they have been absolutely phenomenal. And I do just once again want to thank our partners at the California Healthcare Foundation and also at the Center for Sierra Healthcare. And also I do just want to say one last thank you to Jim Ketty and Sarah. You guys have been phenomenal. I want to thank you for inviting us today and for just really walking hand in hand in this effort, and super excited about this work. And if you are curious about it, please visit our website, and there's a ton more information. So thank you.
Thank you so much, Marlise, for that presentation on the Elevate Youth California grant. I appreciate you highlighting how you're providing technical assistance and capacity needs as these organizations are navigating COVID and still trying to provide those, youth development and mentoring to, reduce substance use, because it is definitely hard. So I appreciate that. If you have any questions about these grant programs, please put them in the chat box so we can get to them at the end. Next, I would like to introduce Jocelyn Peterson and Melissa Jones at the California Natural Resources Agency.
Thank you, Sarah Michael, and thank you everybody for the opportunity to be here today. I'm going to speak to you about our Youth Community Access Program, which is funded, as Marlise mentioned. Can you advance to the next slide, please? So this is just a brief overview of everything we're going to be discussing in the next few minutes. We'll talk about the funding available, eligible applicants and projects, funding priorities, and the selection process, and then we'll kind of wrap up with where we are with the program right now. So as Marlise mentioned, agency receives a portion of the YPITA account for the Youth Community Access Program. So we have approximately $13.5 million available for the cycle that's currently under review. And the minimum award for the program is $25,000 and the maximum award is $300,000. And finally, we have a minimum of 90% of the awards will go to projects that are located within and serving underserved and low-income communities. And Joss, we'll go this in a little more detail in a few minutes. So what's happened to date? So in the budget of 2019, that was what created the Youth Community Access Program. We received a little over $5 million. And so once we received the funding, we started out by going to create this new program. We started out by going out to doing community listening sessions, and we did 7 sessions across the state. And these sessions really informed the guidelines that are currently out and the development of that process. The draft guidelines after these sessions were released in February of 2020. An agency conducted 2 public hearings in early March. This was just before COVID. And one was in Sacramento, which was webcast, and the other one was in Southern California. And then after that, we released the final guidelines and solicitation, which was in July of 2020. And at that time, staff conducted 8 virtual workshops, technical assistance workshops, and we had approximately about 400 people attending those. The proposals were due in the fall of 2020, and we received approximately 300 proposals that are currently under review. So eligible applicants are local, state, and federal agencies, nonprofits, federally recognized tribes, and non-federally recognized tribes on the California Tribal Consultation List. One thing, if you're a nonprofit, you must be a 501c3 qualified to do business in California and be incorporated for at least 2 years at the time of application. So the Youth Community Access Program supports programming and small capital asset projects that increase youth access to natural or cultural resources. And I'll go over a bit more of that in the next few slides. So Under the Youth Community Access Program, all projects must meet 3 general requirements. Number 1 is projects must serve youth. And for the purposes of this program, youth is defined as a person between the ages of birth and 26 years old. Secondly, projects must increase youth accessibility to natural cultural resources. And finally, projects must include design features and elements that promote youth health, safety, comfort, and well-being. And health can be physical health, emotional health, and mental health. So there are 3 types of projects that can be submitted for this program. Programming only activities, capital project only activities, and this can include either a vehicle acquisition or the development or construction of a site, and either a combination of one of those. So a combination of either a program and developing a site, or a program and acquiring a vehicle. When submitting a combination project, the capital project and the programming project must be interrelated. They must connect to each other. So on the screen here are some examples of programming only activities. It can be free or reduced admission to a natural or cultural resource, cultural festivals and outreach events for youth, youth-led volunteer or stewardship programs, or youth-led outdoor education programs. You may notice that several of the examples include the phrase youth-led, and youth-led means when youth are involved in the planning, design, and implementation of what you are proposing. And Jocelyn will discuss that a little bit more in a minute. There's also capital projects, and on the screen here are some examples. We've got the constructing ADA improvements to increase youth accessibility to a natural or cultural resource, creating cultural installations or exhibitions for youth. And then finally, the acquisition of a clean vehicle to transport youth to a natural or cultural resource. And I want to highlight this one here because from the community listening sessions, when asked what the number one opposition or obstacle, that's the word, obstacle was for youth access, was transportation. So a vehicle acquisition of the acquisition of clean vehicles is eligible for this program. And then finally, we've got the combinations. On the screen here is an example, and that would be the purchasing a clean vehicle and creating a program which uses the vehicle to transport youth to a nearby resource. You'll notice in this example, the programming element and the capital element are interconnected. You're acquiring a vehicle, and then you're using that vehicle to take youth to a natural cultural resource. Now I'm going to turn it over to Jocelyn to talk about some of the funding priorities and other elements of the program.
Thanks, Melissa. There are 3 main funding priorities for the program. They are not required to be eligible, but make a project more competitive. The first is projects that feature youth-led opportunities. This means that it is not just a project that benefits youth, but that youth are also involved in the planning, implementation, etc. of the project. Second is projects that propose resource awareness campaigns featuring youth and using youth vernacular. This means that the outreach materials and any program material is specifically designed in a way that the youth being served understand and can connect to it. Third is projects that empower youth to make healthy choices. This would include projects that foster confidence, self-awareness, and other skills that the youth can use in making healthy choices, such as refraining from substance use. This program intends to award a minimum of 90% of all grant funding to projects located within and providing benefits to underserved and low-income communities. For the purpose of this program, underserved communities include communities of color and vulnerable populations. These communities are further defined on the slide here. For example, vulnerable populations include foster and transition age youth, LGBTQIA youth, youth with disabilities, youth involved in the juvenile or criminal justice system, and other youth populations disproportionately affected by past state and federal drug policies. Any of the communities in either main category would fit the definition of underserved for the program. The purpose of these funds is to serve communities that were disproportionately affected by past state and federal drug policies. These specific communities have been identified as meeting that intent. For this program, low income is defined as a community with an annual median household income less than 80% of the statewide average. A common tool to determine this is the State Parks Community Fact Finder. This tool will overlay a map with purple for disadvantaged or yellow for severely disadvantaged. Either of these designations would count as low income. The Department of Water Resources also has a tool that can be used. This shows the level of disadvantaged communities using different shades of tan or brown. We have a 3-step progressive evaluation process that cuts down on the amount of upfront work for the initial submission. All applicants will participate in the first step of the process by submitting a project proposal on our System for Online Application Review, also known as SOAR. The project proposals will be evaluated and scored, and only the most competitive proposals will be invited to participate in Step 2, where we will conduct a field inspection. The most competitive projects emerging from the field inspection will move to Step 3, which requires submission of documentation supporting the project for further evaluation. After Step 3, agency will create a list of final funding recommendations, which will go to the Secretary for Natural Resources for approval. New grantees will work with agency staff to develop grant agreements and then start working on their project. Okay, on the screen, you'll see the anticipated timeline. So right now, the current cycle of projects is underway for the project review. Once we complete this initial project review, we'll begin field inspections running between April and June of this year. Step 3 with supporting documentation is expected to occur between July and August of this year, with grant awards being announced fall 2021. Soon after, in late 2021, the new solicitation is expected to open. All right, on this next slide here is our contact information, website, and email address. Thank you.
Thank you so much, Jocelyn and Melissa, for that presentation on the Youth Community Access Grant Program. It's the relatively new compared to the GoBiz and the Elevate Youth California grant program, but it's really innovative in that, using cannabis money to provide youth access to natural and cultural resources. And I think, it has that understanding that youth in the outdoors is connected to their physical, mental, and emotional, success. And so I think that's, really cool. So thank you so much for giving an overview of that grant program. Again, I want to remind everyone that we really appreciate your questions and, to put them in the chat so we can have our presenters address them at the end. And next, I would like to introduce Helene Zentner from the Board of State and Community Corrections.
Great. Thank you. Good morning. My name is Helene Zentner, and I'm a field representative and lead staff on the Proposition 64 Public Health and Safety Grant Program with the Board of State and Community Corrections, or more informally, the BSCC. I'd also like to introduce the Prop 64 program analyst, Michelle Killian, who's on this call and is working with me on this grant program. Thank you very much, everyone, for the opportunity to provide this information on the BSCC's Prop 64 Public Health and Safety Funds. I'd like to thank Jim Ketty and Michelle Michael Gaston with the Youth Forward, and then the Alliance for Boys and Men of Color and the California Urban Partnership for affording me this opportunity. So for those of you who don't know the BSCC, I'd like to take just a brief moment to tell you who we are and what we do. We've had a lot of iterations as an state agency over the last 80 years. It originally started in the 1940s as the Board of Charities. Then in the 1970s, we became the Board of Corrections. And in 2004, the Correction Standards Authority, and in 2012 became the current agency of Board and State Community Corrections, even though during that whole time we still have done the same types of work. And as part of our work, we use an executive steering committee process to inform decision-making related to the board's programs, including the distribution of funds and the development of regulations. And part of that process is it's essential that those that are impacted by our work be included on executive steering committees and our work groups. So we solicit a wide range of stakeholders from across the state, including a variety of disciplines and professions, geographical areas, race, ethnicity, and those with lived experience to collaboratively develop our deliverables, such as this request for proposals. So real briefly, we're small but mighty. We only have about 100 employees, and we have different divisions here at the BSCC. Our division is the CPGP, and we administer both federal state programs for local partners that are designed to reduce recidivism through evidence-based intervention, education, and prevention strategies. Then we have several other divisions that you might be more familiar with, like our Facility Standards and Operation Division, who develop them or inspect for the minimum standards in local detention facilities, inspect those facilities. Our STC division, which provides the minimum selection and training standards to improve professional competence in local correction staff. And then our construction division, which administers financing for construction projects. The BSCC takes our charge from the Revenue and Taxation Code, and more specifically Section 34019. Those are eligible applicants it tells us what we can do and what type of purposes for the monies that we are appropriated through Prop 64. So as you can see on the slide, there's a broad range of activities that can be covered using our Prop 64 funds. When it all boils down to it, though, these funds and all the program components must link to the intent of the Prop 64 initiative, which are local impacts due to the legalization of cannabis in California. And our grant is a bit different than the others that you've heard from today. One is we have a very broad range of activities for this grant and what it can fund. The information before you is basically the information that we have to go on, and our executive steering committee takes that information and develops the solicitation that we have. And first, that's a little bit different, is our grant currently has one cohort. It's 10 grantees. There's 9 counties and 1 city that just began their projects in October of 2020. So they're just beginning their implementation of projects. And then the current solicitation for application will be due in just 10 days. So at the end of this month. At the end of this presentation, there'll be a slide with a web address and an email box for more information on not only our current cohort of 10 grantees, but also the request for proposals and a little bit more about our executive steering committee process. So the Proposition 64 Public Health and Safety Grant through the BSCC, the eligible applicants in code are local governments, which basically means cities and counties in California. And then those cities and counties that can apply or are eligible cannot have banned the commercial cultivation or retail sale of marijuana or marijuana products. So since cities and counties are the eligible applicants, the grant requires a single point of contact for the Prop 64 grant, or what we are considering the lead public agency. And this government agency or department is ultimately responsible for all contractual requirements of the grant. And as the lead public agency, they are the ones who will be coordinating and subcontracting with either other local agencies, community-based organizations, and/or tribes. So a quick summary of the funding that we have that's current right now, like I said, is due on January 29th, is that we have a little less than $52 million to go out to the eligible applicants, which are the cities and counties in California. Each jurisdiction may only submit one proposal for funding. So this is a collaborative effort for the cities and the counties to pick their priorities for our Prop 64 funding. And jurisdictions who were awarded in the original round of funding, cohort 1, are not eligible for this round. So cities and counties can apply through a single application, or they can apply through a collaborative, which is either 2 or more cities together, 2 or more counties together, or a combination of a city and a county. And all of those jurisdictions must be eligible in order to apply. And our grants are awarded for a 3-year term. So this cohort that is under solicitation right now should begin in May of this year and then run for 3 years. On the screen also is the inbox that we have for this cohort if you have any questions about either the information in this presentation or about the BSCC's Public Health and Safety Grant. So real briefly, on the prior slide or previous slide, I talked about who the eligible applicants are, being local governments or cities and counties that have not banned the commercial cultivation or retail sale of cannabis or cannabis products. So this slide is a very simplified version of the cultivation component of eligibility. So if a county has banned all indoor commercial cultivation or all outdoor commercial cultivation, then they would not be eligible for funding. They have to basically allow for some of either indoor or outdoor commercial cultivation. And the jurisdictions that are in the process of legalizing the cultivation of cannabis are ineligible for this current funding, but depending on their ordinances in future solicitations, they may be eligible for future grants through the BSCC. So for retail sales, counties and cities have a retail component that they must not prohibit the establishment or the operations of businesses licensed to sell or distribute cannabis in their city or county. And again, here, if either of those statements are true, the city or county is ineligible for this BSCC funding. So for the current tax code, or revenue and taxation code, this is just a simplified version of what is considered not banned in our RFP. So if they restrict retail sales to specific locations or due to certain zoning ordinances, that does not necessarily preclude a city or county from applying, and that it really does depend on the licensure of those retail establishments and the activities that they are able to do, that we are able to determine whether or not a city or county meets the retail component of eligibility. And additionally, as part of the revenue and tax code, if a government allows for cannabis delivery but does not allow for the sales or the establishment of a local operation, they are also not eligible for this funding. There's a lot of nuances to the definitions of banned, of cultivation, retail sales, licenses, and so on, as you can imagine. So as part of the competitive grant process, we host a bidders conference that is open to the public, that we walk through the request for proposals and the details of that document and allow for questions from the field to be able to provide clarification on any information contained within that current solicitation. So as I mentioned before, the current RFP allocates almost $52 million in Proposition 64 public health and safety funds through the BSCC. part of the funding that our executive steering committee has determined is that they wanted to make sure that there was a little bit of funding for all different sized communities. So the county breakout is 20% of that 52 million for small sized counties, 20% for medium-sized counties, and 20% for large-sized counties. And if an applicant is a city, we put them in the category of what county size that they reside in. And then the rest of the funding, the 40%, goes to the highest ranked proposals that haven't been funded in one of those county-sized components above, regardless of where they fall. So the county size breakout that the BSCC uses is based on the Department of Finance's estimates as of January 1, 2019. And if there's not sufficient qualified applicants in any set-aside county size category to exhaust all the funds, those funds then augment that 40% pot, if you will, of funding for those highest rated categories. So as I mentioned before, all Prop 64 funds through the BSCC funding and activities must have a nexus to the impact or impacts of legalizing the recreational use of cannabis in California. So I'd like to talk right now really briefly about the program or the project purpose areas that this RFP looks at for the grant funding into those counties and cities. So applicants must propose activities and strategies that fall within one of these 4 project purpose areas, or PPAs. So there is the youth development and youth prevention and intervention component, public health, public safety, and environmental impacts. The one thing that the Executive Steering Committee wanted to make sure was that every program had a mandatory component for the youth development and the youth prevention and intervention PPA. So there is a mandatory 10% of the requested budget funds that must go towards this area. And it is separated out in the application so that we can tell exactly what they're planning to do with that funds. As you can see, there are probably lots of different overlaps between these PPAs. And so a city or county, depending on their need, can apply for any combination of these. However, the PPA one is mandatory. So for the PPA one, here is just a few things that can be used for programs that are seeking funding. I want to first point out, though, that youth for the Prop 64 Public Health and Safety Committee or program is defined as individuals under the age of 21, or other words, those not of legal age to use or purchase cannabis or cannabis products. So the use of evidence-based and promising practice is also encouraged within any of the service delivery components for the proposal to support effective outcomes. And we also provide assistance for those programs to use a risk, need, and responsivity model to encourage and to assess the various factors that may be barriers and or needs to the project participants under this PPA. And what we also do is we require the applicants to provide the interventions or the curriculum that they are using, and we want to make sure that they have been demonstrated by research of having an effective in the proposal's desired outcomes based on its goals and objectives in each PPA. The second PPA is activities that may be funded through public health in communities, and those can range anywhere from public health training and education, information and outreach, inspection and enforcement of, excuse me, cannabis businesses, behavioral and mental health treatment, product safety, cannabis testing, safety equipment, pesticide impact efforts, drinking waste water system updates, air quality efforts, and other environmental system updates. So as you can see, the funding through the BSCC has a really broad range of activities that can be requested for funding. Then the third project purpose area is public safety. Again, a lot of overlap and different activities that can be included in this program purpose area is public information and outreach, training efforts, law enforcement, code enforcement, delivery compliance, community planning and development efforts, safety equipment, updates to technology for tracking and tracing, transportation impacts, fire protection, fuel mitigation, and wildland and urban interface planning and implementation. So again, lots of different things that this money can cover. Then for the final project purpose area is environmental impacts, and some of the activities are on your screen, but also not limited to technology software, odor abatement, nuisance abatement, forest management. We've never really gotten into the realm of fire management, but this grant program does allow for it. Hazardous cleanup, sediment testing, aquatic protections, water systems and storage, and pesticide impacts. So lots and lots of things that are a bit different than the other projects that you've heard today or funding sources from the Prop 64 initiative. Ours is kind of a catch-all for everything, but I do want to stress that we are, besides the program purpose area 1 of the youth and development is only 10% minimum. Projects can use 100% of that project purpose area for their proposal. So there's just a couple different ways to stay informed about this grant through the BSCC and other funding opportunities, and those are on your screen. There is our website has a quick links that will take you to a place where you can get on a listserv for funding opportunities and RFP availability and different ways to stay connected with the BSCC. I just wanted to say real quickly that there is an annual appropriation in the governor's budget for this funding. So we will be going out for future solicitations, but currently there is no time frame for future funding. It's all tentative because our projects are so new. We want to be able to look at our cohort 1 and our cohort 2, their goals and objectives, and make sure that the RFP that we have currently developed by the Executive Steering Committee is really working to the best intent and effectiveness for this funding. So this is, by connecting to our listserv, you'll be able to know when future funding is coming out. And then finally, this information on the slide provides you with how to get in contact with us. The email address that you see on the screen will connect to several of us on the Prop 64 team, and we can answer any questions you will have. And then the website is the website where you can find information about our current grantees and also for the current solicitation that is out in the field. And again, I'd like to thank everyone for joining today to hear more about these programs, and thank you all for your time.
Great, thank you, Helene, and many thanks to all the presenters. I know that was a bit of an information deluge. As I mentioned previously, we are recording the session, and we will be emailing you links both to the recording and to the slides within the next couple days. So we did get some questions in the chat about the contact information, which probably flew by you, but you will be able to capture that in the slides as well as in the recording when we send that out to everyone who registered in the next couple days. Okay, so now what we're going to do is take a couple questions. Then after questions, I am going to do a quick review of the upcoming sessions, and some of the questions that are in the chat I believe are better answered by one of our upcoming sessions. But for the first question, we received a question about eligibility by geography, and I wanted to stress that the first 3 grant programs that you saw presented by GoBiz, by the Department of Healthcare Services, and by the California Natural Resources Agency do not have the same kinds of restrictions on where they can make grants as the presentation just made by Helene and the program managed by the Board and State of Community Corrections. So within Proposition 64, there was language specific to that BSCC grant program that made it so that only cities and counties that are, allow for cannabis businesses of the types that she described, those are the only eligible agencies. But that criteria does not apply to the 3 grant programs that were in the first part of our session today. So I thought that was important to point out. So for example, if you live in a city that, if you're in a nonprofit organization in a city that bans cannabis, you're not being limited to look at applying for those other grant programs. So let me ask Helene. We have a question. We'll go ahead and do questions for Helene first. And one question that came up, Helene, is if a county is funded, a city within that county that fits the criteria, would that city still be eligible to apply?
Yes, so each county is their own jurisdiction and can apply as long as they're eligible. And then every city in California, regardless of what county may be receiving those funds, are also eligible as long as they're eligible per the criteria.
Great, thank you. So another question for the BSCC program, Helene, is with the emphasis in that program on funding youth development, youth prevention. So is it possible for a city or county, a local government, to subcontract with a community-based organization, for hypothetically a youth development organization, in order to provide services in the areas that you described?
Absolutely. So even though these funds are going to cities and counties, we require a lead government agency, a public department within the county or city, and they are ultimately responsible for the distribution of funds, and they would be the ones who would be partnering with subcontractors, community-based organizations for any of those project purpose areas.
Okay, great. Thank you. The next question, I'm going to move over to Melissa with the California Natural Resources Agency. We'll find Melissa here. And Melissa, the question is, for your program, how do you go about defining what is a cultural resource, or how do you think about the cultural resource part of your program?
Yeah, there are definitions for both a natural and cultural resource in the guidelines in the appendix for definitions. Sorry, I don't have them up in front of me right now, but I would encourage whoever's asking to look at the definition in the guidelines in the appendix. But there are definitions for natural resource and cultural resource in there.
Okay, great. Thank you. All right, let me just do a quick check here on other questions in the queue.
I can answer the cultural resource definition, Jim.
Oh, please, Sarah. Thank you.
So I pulled up the cultural resource definition out of the Natural Resource Agency guidelines, and it means tangible physical evidence or place of past human activity. These may include buildings, structures, prehistoric sites, historic or prehistoric objects or collections, rock inspirations, religious sites, and landscapes or natural features of significance to a group of people.
Great, thank you, Sarah. Okay, we did get a question about whether there's a website that has all this in one place. And on our Youth Forward website, we have been posting regular information about these grant programs. We also have been trying to alert particularly the nonprofit community about opportunities as RFPs are released. So certainly you can keep an eye on our website for updates. We are in the process of authoring a paper that describes the 4 grant programs, so we have something all in one place with some descriptions of each program. That is something we're hoping to get out to everyone, certainly by mid-February. But this is actually the first time we've pulled together the agencies and have put all of this information into one place. So we're excited to be able to share that information. What I'd like to do next is to show you the slide of the upcoming sessions and just let you know, for those of you who had some questions about other topics, how you can find those. So this Thursday at 10 a.m., we're holding a session on youth development in the era of COVID. And those of us who work in the youth space, of course, have been dealing with a brand new reality, as we all have, which is how do you provide support to young people and young adults, given school closures and social distancing, economic stress, and certainly great stress on the mental health of young people and young adults. So back in December, working with our partners at GoBiz and at the Department of Healthcare Services, we did some surveying of grantees working with young people and asked, basically got feedback from them on how it was going. But we also looked specifically at what were innovations that they were developing, what were emerging best practices in the area in youth development given COVID-19. So in the session on Thursday, our researchers will be sharing what they learned from doing that survey and some follow-up interviews. We're also going to have some great panelists who work in youth development who'll be able to share kind of what they've been learning about how to reach, engage, and support young people during COVID-19. So please consider joining us for that session. And then next Tuesday of the following week, we will be having a session specifically on the marijuana industry and equity. And there were some questions in the chat box about that. That session will be led by my friend and colleague, Malachi Sekou Amen. And so for everyone joining us today who's interested in equity and the cannabis business, how entrepreneurs of color are entering the field, what the obstacles are, what the experience of people in the field has been, who are coming from communities of color, I think that's the right session for you. And then just briefly, we're also doing a session on local cannabis tax revenue. So everything you've heard today has had to do with revenue that the state collects and the state manages and allocates. But there's a parallel dynamic happening out there because cities and counties, many have local taxes on the books and are also collecting revenue. We're going to do a session on what we're learning about the cannabis industry and public health on February 2nd, a session on organizing coalition building, and then our last session on February 9th has to do with healing-centered and trauma-informed approaches, which, as you've heard in the presentation today, has been a common theme in the work that the state agencies have been doing, as well as many of us who've been working with those agencies. All right, so I want to thank everyone again. I particularly want to thank our leaders from the state agencies who joined us for taking the time to share the work that you're doing, and to my colleague, Sarah Michael Gaston, to Mark Philpart, and to the person who's behind the scenes who makes all of this happen. It was Eric Morrison Smith with the Alliance for Boys and Men of Color. Hope to see you at a next session.